Dr. Wilcox is with us. We call it Dr. Wilcox Thursday because this has been your day recently.
Yes, and I am talking of concussions.
Okay.
So I'm an eye doctor. I do all the eye doctor things that you're familiar with. I'm an optometrist, glasses, contacts, normal stuff, and then a lot of atypical things because that's how I butter my bread. My interests lie there. The eyes are brain, and 50 to 60% of the brain is given to vision and vision-related tasks. So you have to not only see things, but you have to remember an apple can be red, and you have to think of red, and how do you say apple after you saw an apple, and how do you respond, and all these little neural networks throughout the whole brain and these different lobes we have are required for us to have good vision and proper tracking of the eyes. 12 cranial nerves, and some directly and indirectly affecting the eyes, over half of them. And so if you have over half of the wires coming out of your computer going to your eyes, you're going to go, well, this is pretty important. And it influences a lot of things. So patients with concussions will typically have motility disorders. Their eyes aren't going to go up, down, and left and right easily, comfortably. They'll have pain around their eyes, retroorbital pain, behind the eyeball pain. They will have sensitivity to light. They're photophobic. You'll have brain fog that is eliciting a lapse in processing, and a number of other things that we're familiar with concussions.
Are the things that you're describing with your average concussion? I don't know if there is an average, but you know what I mean.
Yes.
A heavier concussion or a lighter concussion, or all of the above?
Yeah, all the above, and it depends. You have to remember the contra coup injury. If I punch you in the front of the head, your brain gets bashed in the back of your skull. So the contra coup, it's the other side that gets the bruise.
Okay.
And when I say a bruise, and it is a bruise, it's a contusion. And there can be overt swelling when you can see edema. That when the doc or the radiologist runs the MRI or CAT scans, but the MRI for the soft tissue, and they can say, aha, I can see where the boo-boo is. And but frequently the MRI and the imaging scans aren't uneventful. They're negative. Now there are these SPECT scans, some fancy schmancy scans where you can see just the microcirculation in the brain, and they're phenomenal, powerful, and very expensive.
That's what
so those aren't traditionally done. So at the end of the day, somebody has concussion, and just think of it as like somebody hits you in the shoulder and gives you a Charlie horse. Well, it hurts. And people were told to go sit in a dark room and be quiet, and that has been found to be the wrong answer. It's no, we need to act. We need to start loosening up the muscle, and we're not doing this in the shoulder, but how do you loosen up the muscle in the brain when there's no
exactly,
muscles there?
Yeah.
Well, so what you do is you have to provide oxygen. You have to increase circulation. If I say boo to you really fast, you go, you get startled. Well, all your blood vessels contracted, and you shunted all your blood to your core so you can get up and run, because that's the fight or flight system. And your sympathetic and your parasympathetic nervous systems are saying, hey, I got to get out of here. So if you hit somebody in the head and they have a shocking event, you're going to have localized inflammation, swelling. We'll call it just a contusion. And then the effects of that part of the brain are going to be realized, because they're going to cause those very symptoms. So what can you do? Well, we use...
can you detect a concussion through an eye exam?
All day long. Because one, I haven't met somebody who says I'm not sensitive to light. Okay, and then the motilities, like, when you get whiplash, that's because one of the cranial nerves that goes to your eye starts in the midbrain. I swear a guy got paid by the mile when it came to putting wires in the head, because we have one of the wires that goes from our midbrain, comes out our cerebral spine, over the apex of our lung, up our neck, and back to our eyes. Like, I'm getting paid by the mile. And so what happens is, when you have this exposure to these long nerves and these pathways, you can, it's easier to have a problem because there's the greater the length of the nerve, then the greater likelihood other things can cause problems. But it also allows you to diagnose, where the event happened, and by deductive reasoning. So back to the concussion. So the patient comes in, will have motility. As the eye doctor, I don't see well. My eyes don't move up and down, left and right well. I'm sensitive to light. I have pain behind my eyes. There's always this retroorbital pain in the throb. So we can, and I've got all these articles here. I've got a ton of articles here, and just to use as a tool, we want to give electrons to the mitochondria to charge it. No different than the heart doctor is going to put the paddles on your chest when you have a heart attack.
Right.
They're introducing external energy in order to reset things. And so you can do that with light. Okay, transcranial, you can shine light across the skull and it'll go into the skull, certain wavelengths of light at certain frequencies in hertz cycles per second. And that is going to assist your mitochondria and the powerhouses, these little organelles that produce ATP, which is the energy units in the body. And your body says, thank you very much. I was not working well. I was jammed up. And now you're giving me the opportunity that I need in order to make energy to repair myself. And
does the degree of the concussion the determining factor in the number of treatments?
Well, so let's I do eye doctor things first, classic eye doctor things. Don't get me wrong, this is all in anybody's purview if you're an optometrist, and you just have to choose to want to learn to do it. And but here's an article from JAMA, the effect of transcranial low-level light therapy versus sham therapy among patients with moderate traumatic brain injury. That means they took a bunch of people and they shine some light across their head and actually up your nose because it's easy to get up that way, and improvement in concussions. Here's another one. Transcranial emitting diode therapy for neuropsychological improvement after traumatic brain injury, a new perspective, blah, blah, and then fancy long title. And it goes through the TBI and how using transcranial light, red light, far red and near infrared light at certain energy levels takes your mitochondria that's been weakened, and it allows it to, and I'm going to read through an article, I'm going to read through a paragraph here that's very well written and kind of esoteric, but I'll slow it down, about just how light, photons of energy are helping. Here's a traumatic brain injury and concussion. Traumatic brain injury concussion. This is I have 20 of them right here from the ViaLight. If people want to go to VIELIGHT and go look up what you can do with that use of that form of energy. But I'm going to read this article, and I'll slow it down and dumb it down, and because it's even hard for me at times. How does photobiomodulation is light life modulating, promote brain injury from TBI? And I'm going to skip through here. Produces short-term increases in ATP, increases blood and lymphatic flow, upregulates the anti-apoptotic proteins. That means you have cells that are dying and dead, and you got to get rid of them, and it increases the rate of you cleaning out the trash. And increases neurogenesis, synaptogenesis, the creation of new neurons that we thought we can never do in the brain, but in the synapses, the communication between neurons, so that information can be transmitted and processed. Reduces edema, reduces inflammation, increases excitotoxicity, affects the mitochondria. And hypoxic, that means low oxygen injured cells, the mitochondria ability to produce ATP is reduced because there's this stuff in our body, nitric oxide, and we make it, okay? And nitric oxide's an ED medicine, erectile dysfunction, and so it improves circulation. And so when you have low nitric oxide, you have poor vascular diameter, and less circulation. The more you have, the more you're going to increase the size of your blood vessels, the more fluid you can get through. And so the photons affect the mitochondrial membrane. And so they make the mitochondria more porous to allow the incoming and outgoing of necessary materials to be effective. So that's enough for light in photobiomodulation.
All right.
The other thing you can do is you can use magnetic fields and the pulsed electromagnetic fields. Magnet on, magnet off, magnet on, magnet off. And then you either have a little sine wave, or you can have a square wave or a sawtooth wave, and you have all these characteristics of what is a magnetic field and how long and how strong does it need to be. And I can't tell you the number of times where we'll just take somebody who has a concussion, suffering from days to months, and sometimes just using magnetic fields and hovering them over the head. And I have a process of I've broken the head up into 10 parts, and we keep track. My tech will sit there and keep track of the patient's reporting of symptoms, and it's just so crazy that that they'll go, I feel something on my knee, I feel that it's warm, it's tingly, it's this and that. And then my philosophy is, if it feels good, touch it, and if it hurts, touch it. And because that has worked for years and years and years, to just say, okay, we found the little spots that your brain is receptive to. It always correlates with the reported concussion. I got hit here, and then we're giving energy. We're allowing the detritus, the dead cells, to be sloughed off. We're reducing inflammation, improving circulation with magnets. Magnetic fields. And there's a zillion of opportunities out there on the market. You can go right now to Amazon and buy all sorts of gadgets and gizmos, and most of them are probably not that great, and many are fantastic. But concussions, that magnetic fields. And so vision therapy, but back to optometry, okay? So people will have what it's called a convergence insufficiency, where their eyes don't want to come together. Our eyes always have to work when we're looking in the distance, they're pointing straight ahead. When we look up close, they have to come together. They're coming together to look up close. And an energy system, a body doesn't want it to do all the work it has to. It wants to get close enough is good enough, because you don't want to waste energy. But all that offset between the distance and the near becomes a greater struggle for people. So if you can put some prism in their glasses, and sometimes a special prism that has variable powers vertically in the lens, it's going to take the monkey off your back. The patient is going to go, oh my God, the relief I have. Oh, this, with these neural lenses or prisms otherwise.
I have a silly question, and it's based on something you just said. It really is silly.
Yep.
How do people cross their eyes?
Well,
when
like this?
Yes, like that.
What? You cross your eyes.
I can't do it.
Well, okay. So you cross your eyes. One, you can just look at your finger up close and your eyes converge. Or two, some of us have the ability to cross your eyes.
Okay, so it's nothing special. Okay.
Yeah. Right. So when you have this these weakened muscles, and there's three major nerves that feed the 6 muscles of the eyes, and they have other jobs as well. But when you have this concussion and you're in the firing, it's like the wire in the wall that's been breached a little bit. There's a short in the wire, and it's going to that one GFI receptacle in your kitchen that takes out the microwave, this, that, and the other, and the lamp in the hallway, wherever that line goes. Well, the same thing goes on in our body. And as the localized swelling, edema, lack of oxygen is compromising the efficiency of the transmission of electrons in all the workings of the human body, then if you go ahead and fix that wire and you reduce the problems associated with the lining of the wire, then you get relief of your problems and your complaints. So,
by the way, this is Dr. Wilcox. His office is down at the Point, the Wilcox Eye Center. probably the most widely read person I have ever met in my life.
Well, that's not saying much because I'm never the smartest guy around. I'm a phone call away from smart people, though. So I try.
If there is a concussion, a suspected concussion, what would you recommend somebody do? Come to see you? Go to the hospital? What do you do?
Well, it depends on the significance of it. It's not always appropriate. The physicians, the primary care docs, and the guys and the gals in the ER, they're not always going to say get an MRI. They're going to look at it and triage it like a MASH unit. Like, okay, with you, what you're going to do is go home and do this, that, and the other. And unfortunately, and that's part of the reason I'm on the radio, is not a lot of people know that we do these things and they're available out there. There's a lot of information. It takes 20 years for things to get from an idea in the laboratory and actually a concluded a practice and knowledge in the laboratory, hey, this works, to get into private practice and to get into practice and mainstream. It takes 2 decades. And so I've spoken of that in the past and how that I like to go look to find these things and bring them in. So another thing, oxygen, the use of ozone. Here's a paper from 2011 and out of it's called brain ischemia or lack of oxygen and hypometabolism. That means low metabolism treated by ozone therapy. And so if you use ozone and people up in the atmosphere, protecting us from UV.
First thing everybody relates
up in the atmosphere, protecting us from UV is the ozone layer, and it knocks out a lot of the harmful cancer-causing UV. However, remember, in normal air, we have about 21% oxygen, and the rest is nitrogen and elephant farts, okay? And or maybe cows. It's more of cows.
Yeah.
And so we have to be careful about confusing using natural air, regular air, to create ozone, a little charge, versus 100% oxygen. So when you use 100% oxygen, you put a little charge in there, you create, instead of O2, you create some O3s and for a little bit, and about 3 to 4% of it will be that. And this lovely cascade happens. And so if you use this, when you're using ozone therapy, it's 97% oxygen therapy and 3% ozone therapy. And there's all these nice lipid peroxides and ozonides and these things that happen that help work on that. But you're providing oxygen. That football player on the sideline who's got the oxygen mask, an elite athlete who can do all they do, and after that, those couple plays is sucking down some oxygen to get back in the game. After you have a concussion, you got to suck down some oxygen and derivatives of, in order to, quote, get back in the game, to re-energize yourself. So that's a real simple way to talk about how ozone works and helping that concussive patient. So remember, we have these mitochondria, we have edema, you have a poor circulation, you have a shocked system. And when you start working on therapy for the eyes, prism for the eyes, maybe here's some electrons with light with photobiomodulation. Here's some magnetic fields. It's a blitzkrieg. Here's some ozone. Here's some CoQ10, and here's some alpha lipoic acid, and here are some other things that your body needs to improve its brain wellness and function. Phosphatidylserine and these other supplements you can take that are known to be good brain foods. So we're there. I'm always happy to help. So anybody can come in on their own. They can say to their doc, "Hey doc, what about this Wilcox guy?" But there's a lot of people who have a brain fog that goes on for a long time after concussion, and we've taken a lot of these people and helped them out. I always underpromise to overdeliver, and every human's different.
And if there's something he doesn't know, trust me, he calls someone who does.
Yeah, and always. I'm constantly shooting out emails to patients, to doctors. In the middle of exam, I'm flipping up the phone and talking to somebody somewhere in the country or outside. I just talked to Cuba yesterday, to Sylvia Menendez, who's a world leader in ozone. And we met in Miami in the fall and at a meeting, and world renowned ozonologist. And so there's a whole opportunity of options out there that you can't fault any one healthcare provider for not knowing them, because there's just too many options.
Yeah.
And I have a few tricks up my sleeve. Happy to talk to people.
All right. Dr. Wilcox, everybody. We'll see you back in a couple of weeks.
I'll be here.